What is gonorrhea? How can I avoid getting gonorrhea? Gonorrhea is a sexually transmitted disease (STD) that can infect both men and women. It can cause infections in the genitals, rectum, and throat. It is a very common infection, especially among young people ages 15 to 24 years. How is gonorrhea spread? You can get gonorrhea by having vaginal, anal, or oral sex with someone who has gonorrhea. A pregnant woman with gonorrhea can give the infection to her baby during childbirth. How can I reduce my risk of getting gonorrhea? The only way to avoid STDs is to not have vaginal, anal, or oral sex. If you are sexually active, you can do the following things to lower your chances of getting gonorrhea. Being in a long-term mutually monogamous relationship with a partner who has been tested and has negative STD test results, using latex condoms the right way every time you have sex. How do I know if I have gonorrhea? Some men with gonorrhea may have no symptoms at all. However, men who do have symptoms may have a burning sensation when urinating, a white, yellow, or green discharge from the penis, painful or swollen testicles, although this is less common. Most women with gonorrhea do not have any symptoms. Even when a woman has symptoms, they are often mild and can be mistaken for a bladder or vaginal infection. Women with gonorrhea are at risk of developing serious complications from the infection, even if they don't have any symptoms. Symptoms in women can include painful or burning sensation when urinating, increased vaginal discharge, vaginal bleeding between periods. Rectal infections may either cause no symptoms or cause symptoms in both men and women that may include discharge, anal itching, soreness, bleeding, painful bowel movements. I was just diagnosed. What do I do now? You should be examined by your doctor if you notice any of these symptoms or if your partner has an STD or symptoms of an STD, such as an unusual sore, a smelly discharge, burning when urinating, or bleeding between periods. Complications. Untreated gonorrhea can lead to major complications, such as infertility in women. Gonorrhea can spread into the uterus and fallopian tubes, causing pelvic inflammatory disease (PID). PID can result in scarring of the tubes, greater risk of pregnancy complications and infertility. PID requires immediate treatment. Infertility in men. Gonorrhea can cause a small, coiled tube in the rear portion of the testicles where the sperm ducts are located, epididymis, to become inflamed, epididymitis. Untreated epididymitis can lead to infertility. Infection that spreads to the joints and other areas of your body. The bacterium that causes gonorrhea can spread through the bloodstream and infect other parts of your body, including your joints. Fever, rash, skin sores, joint pain, swelling and stiffness are possible results. Increased risk of HIV/AIDS. Having gonorrhea makes you more susceptible to infection with human immunodeficiency virus (HIV), the virus that leads to AIDS. People who have both gonorrhea and HIV are able to pass both diseases more readily to their partners. Complications in babies. Babies who contract gonorrhea from their mothers during birth can develop blindness, sores on the scalp and infections. Prevention to reduce your gonorrhea risk. Use a condom if you have sex. Abstaining from sex is the surest way to prevent gonorrhea. But if you choose to have sex, use a condom during any type of sexual contact, including anal sex, oral sex or vaginal sex. Limit your number of sex partners. Being in a monogamous relationship in which neither partner has sex with anyone else can lower your risk. Be sure you and your partner are tested for sexually transmitted infections. Before you have sex, get tested and share your results with each other. Don't have sex with someone who appears to have a sexually transmitted infection. If your partner has signs or symptoms of a sexually transmitted infection, such as burning during urination or a genital rash or sore, don't have sex with that person. Consider regular gonorrhea screening. Annual screening is recommended for sexually active women younger than 25 and for older women at increased risk of infection. This includes women who have a new sex partner, more than one sex partner, a sex partner with other partners, or a sex partner who has a sexually transmitted infection. Regular screening is also recommended for men who have sex with men, as well as their partners. To avoid getting gonorrhea again, abstain from sex until after you and your sex partner have completed treatment and after symptoms are gone. Can gonorrhea be cured? Yes, gonorrhea can be cured with the right treatment. It is important that you take all of the medication your doctor prescribes to cure your infection. Medication for gonorrhea should not be shared with anyone. Although medication will stop the infection, it will not undo any permanent damage caused by the disease. Antibiotic-resistant gonorrhea. It is becoming harder to treat some gonorrhea, as drug-resistant strains of gonorrhea are increasing. If your symptoms continue for more than a few days after receiving treatment, you should return to a health care provider to be checked again.